The Brahams Protocol is a groundbreaking revolution, a transformative paradigm that for the first time in the history of humankind grants you the power, the knowledge and the resilience to confront this battle head on. The time to act is now, because every moment counts and every life deserves to be fought for. Protocol is elegantly simple yet profoundly significant. It is a twofold approach comprising of inspection, that is to see, to look, and palpation, to feel. This meticulous yet intimate process demands no elaborate medical apparatus, as no sophisticated equipment or clinical setting is required. All it needs are merely your eyes and hands, a private, comfortable environment, and definitely the informed consent of the lady. This entire examination requires less than 10 minutes. When is the right time? It is a commitment beyond a single instance, and therefore there is no rigid schedule. But for optimal efficacy, it is advised that in menstruating women with a regular cycle, the ideal time would be 3 to 4 days after the cycle, when hormonal influences on the breast become minimal. For menopausal or women with irregular cycles, a fixed date, perhaps a birthday, an anniversary, or any significant recurring moment should be chosen each month. So now let's come to the first component of Brahams Protocol, and that is inspection, that is to see. My dear friends, the power of perception. The eyes only see what the mind knows. So whenever you get an opportunity, observe with a keen sense of concern and interest. An impression can be done under two scenarios. Number one, during hugging, cuddling, embracing, and daily intimate moments of companionship. Observe for any kind of asymmetry between the breasts, such as change in the contour of one breast, levels of the nipples, any discharge from the nipple, or any visible lump, and pay attention even to the most minor irregularities. It is crucial to recognize that the majority of breast cancers in the early stages remain asymptomatic, often developing silently without causing any overt discomfort. When symptoms do emerge, they are often non-specific and subtle, making them easy to be overlooked. Thus, no complaint, however minor, should be disregarded. The second scenario is during intimacy. Observe, given the dynamic anatomical nature of breast tissue, certain abnormalities may only become evident in particular positions due to gravitational redistribution or muscular contraction. And you need to look for, number one, any asymmetry in the contour, the size and shape of the breasts. A new onset disproportion, especially if one breast appears noticeably larger or distorted, warrants concern. Secondly, look for any puckering or dimpling. Thirdly, any redness or orange peel-like skin. Fourthly, any engorged veins. The fifth component, you look for the nipples. And the nipples, you need to look for, number one, any discharge. Discharge can be bloody, that is red blood tinged, or serosanguinous, that is blood with a fluid, clear fluid, or serous. Serous is watery nipple discharge. Now these are obvious signs. In a recent study, 30.3% of women with bloody nipple discharge and 17.6% with serous discharge were subsequently diagnosed with breast cancer. So second thing you have to look for is any recent contraction or retraction or inversion of nipples. Recent or new onset or unilateral, that is on one side only, inversion suggests associated with cancer. Thirdly, any asymmetry of the nipples. Any uneven nipple positioning or deviation could be due to an underlying cancer. And number four, eczema. The fifth component which you need to see is the areolas. One should look for any discoloration, nodularity, or localized edema. We come to the most critical component of Brahams protocol and palpation. Feel. Give you a brief overview by enumerating the 7 steps of palpation, which are the heart and soul of Brahams Protocol. The aim is to make you connect with each step. So let's start. Number 1, use the first 3 fingers, the index, middle and ring fingers held together for palpation. Number 2, use the flat pads of the 3 fingers. Number 3, how to palpate, feeling the breast tissue accurately using counter pressure and pressure modulation. 4th, use of circular finger movements at every spot. 5th, screening the entire breast using one or all the 3 methods that I am going to tell you today. 6thly, do not ignore the axilla, that is the armpits. And 7th is examination of the nipple areolar complex. Start with the first step, that is use the first 3 fingers, that is the index, middle and ring held together, not separately. Therefore, the second cardinal principle, that is use the flat pads of 3 fingers together. Palpation is to be the flat pads and not the tips. So now we come to the third important step and the cardinal principle, that is to palpate the breast tissue accurately. Know that the breast rests on the ribs and that from the chest wall, and this is obviously a firm structure. Thus the ribs, the intercostal muscles, they serve as a firm immobile surface against which the breast tissue can be compressed to feel for a lump. Now comes another important scientific aspect of pressure modulation. As we all know, the breast tissues do not have a uniform density and thickness, and try to feel for a lump by gently pressing the breast tissue by 3 finger pads against the chest wall, applying varying degrees of pressure. Use light pressure where tissue density is less, such as near the clavicles, that is the collarbone. Slightly increasing the pressure, that is moderate pressure as you come down, and finally firm pressure in and around the nipples. This will need some time and effort on your part, but gradually you will become a master in this step. And the 4th is use of circular finger movements at every spot. Instead of imagining a tumor as a smooth round mass, think of it as a ginger root. Circular palpation allows for multi-directional contact, improving the ability to detect small irregular tumor extensions. To the 5th important principle of Brahams Protocol, and that is comprehensive breast screening, that is screening the entire breast. It's crucial to systematically screen the entire breast surface rather than employing a haphazard approach. So before we palpate, we must know what are the anatomical boundaries of the breast. Where does the breast start from? So if you must understand the upper boundary is the clavicle. This is the clavicle, this is the collarbone. This serves as the superior limit. Inferiorly, that is the lower boundary, the inframammary fold. This is the inframammary fold where the breast meets the chest wall. This marks the lower limit. Medially, that is the inner boundary, is the sternum. This is the chest bone, and this sternum, the chest bone, serves as the inner boundary, ensuring that medial breast tissue is adequately screened. And lateral, that is the outer boundary, the mid-axillary line. This is the armpit, the middle of the armpit. So the breast does not end at the beginning of the armpit, it goes up to the middle of the armpit. I am explaining 3 scientific methods. You can use any one or all of them as per your comfort and convenience. Now all the 3 have nearly the same sensitivity and specificity when trying to find a breast lump. The first method is the clock pattern. So first step 1 is you visualize the breast as a clock face, the dial of your watch or that of the alarm clock you have at home. So imagine this is the complete clock. The central point is the nipple. So 12 o'clock, is the superior most portion directly below the collarbone, the clavicle. 3 o'clock is the lateral portion towards the outer side near the inside the armpit. 6 o'clock is the inferior position near the inframammary fold. 9 o'clock is the medial position closest to the sternum. So this is the first step. Second step is initiating palpation from the outermost periphery. That is, begin palpation at 12 o'clock position. Apply light, medium and deep pressures sequentially. You can move clockwise or you can move anti-clockwise depending on how you want to go, how you're comfortable with the hands. So as you can see, I am going in this direction. I am palpating using the 3 finger pads, and I am applying pressure in a rotatory manner, and I am going completely outside, bigger circles, right, covering the entire breast. And as I come back to the 12 o'clock position, after completing the first rotation, we keep decreasing the radius and repeat the circular palpation, moving inwards toward the nipple from outside to inside. Finally, we end at the nipple, and then we repeat the same process at the other breast. To another very interesting method of examining the complete breast, and my dear friend, this is called, I have named it the pizza pattern. In this method, we visualize the breast as a circular structure, that's your pizza, divided into multiple pizza slices. Each pizza slice is a wedge, has to be examined separately. Now here we move in a linear direction from periphery towards the nipple. You start your palpation from the outermost periphery. Now you can place the pads of your 3 fingers, again middle index about half an inch below the chest clavicle, and using a gliding motion here, move in a straight line towards the nipple. As you do it once, again go back to start again from reposition the fingers at the outer edge of the adjacent wedge. Keep going, and now I have completed examination of one wedge. Continue this process until all wedge sectors have been covered. Do not forget adjusting the pressure for depth differentiation as I explained to you earlier. So 2 methods, and now coming to the third method. This is again a very interesting method, and this method is the mesh pattern. Mesh, that is vertical and horizontal glide technique, and it can be specifically practiced when the lady is lying down on her back. So what is the first step? We place our fingers just below the clavicle, that is the collarbone, on either the innermost or the outermost aspect of the breast, depending on your convenience. Now start moving the fingers in a straight line, linear path, advancing in a controlled manner from above to below across the entire breast surface from the clavicle to the inframammary fold. Step 2, once you have reached the inframammary fold, again go up, restart just adjacent to the where you started earlier. For example, if you started the outermost, you can go slightly inside. If you started from the innermost, you can come out slightly outside, and again the same straight line. Step 3, once you have completed from upwards to from the clavicle to the inframammary folds, we start from the upper end of the sternum, which is the chest bone. We start from the upper end of the sternum, and again we move our fingers from outwards towards from inwards towards the outward, that is towards the mid-axial line. Same motion, gliding motion, and once you reach the outermost aspect of the breast, lift your fingers, restart from the sternum, and this time just below the point from where I explained to you earlier. At the end of the process, you have done vertical and you have done horizontal like a mesh. Coming to the 6th cardinal principle, do not ignore the axilla or the armpits. To feel for the lymph nodes in the axilla, you have to ensure a systemic and thorough assessment. We visualize the axilla as an inverted cup. This is the axilla, it's an inverted cup. The walls represent the anterior the posterior, the medial and the lateral boundaries of axilla. The roof of the axilla as the base of the inverted cup signifies the apical and the subclavicular lymph nodes. Now the technique for palpation remains the same. We utilize the pads of the index, middle and the ring finger. We apply gentle firm pressure, systematically moving from superficial to deep tissues and palpate in a circular motion, as lymph nodes are often small, round and mobile, and they require dynamic tactile engagement for effective detection. So we proceed from wall to wall, starting from the front, that is the anterior wall, that is the pectoral nodes. We press gently against the chest muscle. Press gently against the chest muscle. This is, if you're visualizing it like this, this is the pectoral muscle sweeping in a vertical motion to detect enlarged or firm lymph nodes. Then the back, the position of the hand will change. The back posterior wall, inner, then the inner, the middle wall, and then the outer, the lateral wall, and finally the roof for the apical nodes. Please be careful, don't use too much of pressure, it can cause a lot of discomfort. What do you have to feel in the axilla? See, please understand that normal lymph nodes are so small, they are round and they are painless and freely mobile that you will not feel them at all. Whereas cancerous nodes will be palpable, that means they will be enlarged. They will also be painless, but will be progressively enlarging, and they are hard and they may be stuck together. It's called matted lymph nodes, and they usually, remember, on one side. Please remember that the axillary lymph node involvement often precedes the detection of a palpable breast mass, making it one of the most important and the earliest indicators of malignancy. Now coming to the last principle and the step of Brahams Protocol, that is examination of the nipple and the areola, together called NAC, nipple areolar complex. The pathological changes in the NAC include abnormal secretions, which I told you during the part of inspection, retraction, ulceration or nodularity. Nipple palpation is done for evaluating presence of any discharge and structural abnormalities, and the technique is very simple. Use your thumb and the index finger, gently compress at the base of the nipple, applying light progressive pressure towards the center. Please be gentle. Remember to do it very gently and not to cause any pain or discomfort. And what do you need to see for? Look for any discharge. Especially see if there is a discharge, what's the color, the consistency and volume. Examine for nipple inversion, retraction or deviation, any ulceration, crusting or eczematous changes. And now for the areolar palpation for detecting subcutaneous nodularity, again the same concept, using the pads of your 3 fingers, gently palpate the areolar region in a radial or circular motion, applying progressive but comfortable pressure. Identify any subcutaneous, that is just below the skin, thickening, nodularity or masses, and examine for asymmetry in the Montgomery glands. At the end, Brahams Protocol is based on the solemn notion that no woman should suffer, no love should be lost to time's cruel hands. It is about ensuring that the warmth of her embrace, the light in her eyes and the laughter in her voice remain untouched by the shadows of fate. And my dear friend, now is the time to embrace this moment and be a part of this revolution. Jai Hind.